Last week, the Ministry of Health confirmed an outbreak of the Ebola Bundibujo virus disease following the death of a 59-year-old Congolese man who had been admitted at Chibuli Hospital. His body was later repatriated to the Democratic Republic of Congo. According to current data, Uganda has registered 2 Ebola cases, both imported. One patient died, while the second patient, a relative of the deceased who had interacted with him, is currently receiving treatment in isolation. Following the confirmation of the outbreak, the Ministry of Health did contact tracing of people who interacted with the patient. So far, about 127 contacts have been identified and placed under isolation and close monitoring.
The contacts are mostly health workers, people who are treating them, the driver who took them to hospital. And they've all been traced, more than 100 of them. They have been identified, they are quarantined, and they're under treatment. So far, there have been no cases of Ebola reported, which means none of them has posted or has tested positive yet.
According to health officials, a contact is somebody who cared for an Ebola patient, such as family members, or a health worker who cared for the patient but did not use the recommended protective measures at the time are also considered contacts. A patient was on the same ward or in the isolation unit with an Ebola patient before it was confirmed to be Ebola are regarded as contacts as well, or someone who washed the bedding or clothing of an Ebola patient during the time of illness. Ebola contacts are actively monitored and, where necessary, isolated for 21 days from the date of their last possible exposure. Following the announcement of the outbreak in Uganda, some activities have been affected, including the suspension of visa operations by the U.S. Embassy in the country. Authorities have also closed the Ishasha-Cheshero border post between Uganda and the Democratic Republic of Congo in Kanungu district to reduce the risk of further spread through cross-border movements of people and goods. Even as some countries issued travel advisories for Uganda, government insists the international community should focus on where the problem is, and the problem is not Uganda.
We should all be making sure that the problem in Ituri, in the eastern part of the Democratic Republic of Congo, is contained. That's how all of us are safe.
Meanwhile, Ebola cases continue to rise in the Democratic Republic of Congo. According to the World Health Organization, more than 500 suspected cases and about 130 suspected deaths have been recorded, while at least 30 cases have so far been confirmed in the northern province of Ituri. Uganda has since intensified screening and surveillance measures while also issuing public health guidelines. The ministry has advised the organizers of mass gatherings in the context of the Ebola outbreak. They must notify the Ministry of Health or district health officers. These include sports events, religious gatherings, social and cultural functions, as well as political events. Authorities say organizers should allow inspection and risk assessment by health officials and designate focal persons to coordinate health and safety measures during events. Organizers are also required to ensure the availability of adequate hand-washing facilities with clean water and soap or alcohol-based sanitizers, as well as temperature screening equipment such as thermal scanners or temperature guns. Places of worship have been advised to provide hand-washing facilities at the entry and exit points, display Ebola prevention messages in English and local languages, maintain proper ventilation, and discourage handshakes and unnecessary physical contact. Business remains usual in the capital, Kampala. Some areas have already taken measures, while others are seen with washing facilities outside their shops. But this is a practice they have had ever since COVID-19 times. Others are not aware about the outbreak.
For sure, it is my first time to have information concerning Ebola from you, but according to me, I've not yet got any information through radio or newspapers.
Ajulidde Museveni yafulumizza kali ku internet n'agamba kati ennamugongo saagalayo olujjudde lw'abantu ne babisazaamu. Yagambye ab'ekongo be basinga oleeta ki akalwadde. Kale awo nabiwuliddeko era bisobola okosa Uganda.
Some of the symptoms of Ebola include sudden fever, weakness or fatigue, vomiting, chest pain, and unexplained bleeding, among others. No, but Atukunda, NTV News.